Okay, so blood vessels coming off from the aorta. We have three main branches that come off the arch of aorta. You have your left subclavian artery. You have your left common carotid artery. And you have your brachiocephalic artery. Brachiocephalic is then going to split off into your right subclavian artery and right common carotid. So again, three main branches that come off of the arch of aorta. You have left subclavian, you have left common carotid, you have brachiocephalic. Brachiocephalic is just this middle portion right here, right before it splits. Okay, you can see it comes up and then it's going to split here and here. So brachiocephalic splits into your right subclavian and right common carotid. Notice that the right common carotid here and the right subclavian doesn't come directly off of the arch of aorta. The brachiocephalic does. So your three main branches are going to be brachiocephalic, left common carotid, left subclavian. Right common carotid here, right subclavian here comes off of brachiocephalic. Now there's going to be a name change here. So your subclavian artery comes down and it changes names into your brachial artery. Comes all the way down. If we look on this side, it pictures it all the way down. Brachial artery comes all the way down, and on the pinky side of the hand, ulnar artery. On the thumb side of the hand, radial artery, just like we did with the skeletal system. So we have radial artery, ulnar artery, brachial artery, that subclavian artery. Okay, so now you're seeing how we got blood from the heart, supplying fresh supply of blood to the head, and also to the upper body by way of the arms. So our common carotids come up and supplies a fresh supply of blood to our brain and all that kind of good jazz. The subclavian is then called axillary, then brachial. You don't need to know axillary, I'm just saying. At every point, it changes names. So then we have the ulnar and radial artery in the forearm, which is here and here. Okay. The way you remember that this is called subclavian artery is because the clavicle would typically be here, correct? So subclavian means up under the clavicle. Sub means under, so subclavian artery. Okay. Now let's look at the lower half of us. Okay. So we said that this aorta changes names, becomes thoracic aorta or descending aorta behind the heart. After it passes the diaphragm, it becomes abdominal aorta. Well, abdominal aorta then is going to send off branches. So these here are your kidneys, okay? So the arteries that it sends off from the abdominal aorta that goes to the kidneys, that's going to be your renal arteries, here and here. This is your spleen, so this would be your splenic artery. I don't know if you need to know that or not, but look in your objectives and contrast everything that I'm saying with your list. But anyway, hepatic artery is going to go to the liver. So this is how we get fresh blood to the entire body. So abdominal aorta comes down and it sends off branches to all of our internal organs there, visceral organs there, to give a fresh blood supply. Now watch this. Abdominal aorta comes all the way down and then it splits. It terminates here. It terminates as our left and right common iliac arteries. Left and right common iliac arteries. Okay, comes down, always picture the body in anatomical body positioning. So this will be your left common iliac artery. It's called iliac because the ilium would technically be here. Right common iliac artery. Okay, right common iliac artery, left common iliac artery proceeds into the lower half of the body as the femoral artery. Femoral artery. You don't need to know popliteal artery, but it carries the same terminology that we talked about way back in chapter 1. So we call popliteal artery here, which I don't think you need to know. That's a 210 thing. But however, just know femoral artery here and anterior tibial artery here. Anterior tibial artery. This is how we got fresh blood all the way from the heart, all the way down to the entire body. So let's go back over that one more time. All the arteries. We have ascending aorta, arch of the aorta, descending or thoracic aorta coming down behind the heart. After we pass the diaphragm, we end up with abdominal aorta. Abdominal aorta gives some branches off along the way like renal artery, splenic artery, hepatic artery. Comes down and it bifurcates, boom, boom, as our left common iliac artery and our right common iliac artery. It proceeds into the thigh as femoral artery. Then it also gives a branch down here as anterior tibial artery. The other set of arteries that you needed to know was on the heart, and that was your coronary arteries. Coronary arteries, that's on the surface of the heart. That's it for your heart, for your arteries. We'll do veins on the next.